Hi, it's Natasha. We're here at ID Week, and we have the pleasure of speaking to both Dr. McManus from the University of Virginia and from New Jersey as well. You represent two generations of infectious disease physicians, and it would just be interesting to hear a little bit of both about what drove you both to the field. So what made you interested in ID in the first place?
Well, it's really having just great mentorship in medical school, the people that inspired me, Dr. Leon Smith, Dr. Donna Loria. They were very present at the hospital, and the most difficult cases came to them to solve, and I aspired to be that person.
Any of this changed as you practiced?
I think it still remains very fresh and interesting, and care of patients with hypertension and diabetes is very important, but I think it can become routine. And infectious disease cases, every case is different. We can touch wound care, travel medicine, the complicated cases in the hospital. Our specialty is explaining what happened. We don't have a procedure. Our procedure is reading the chart and explaining what happened to the patient and their family.
And so your daughter actually also went into infectious diseases, so must have seen that you were pretty happy. Can you tell us a little bit about what brought you to infectious diseases?
So I obviously grew up around medicine, and I liked the idea that you got to talk to patients, hear their story, kind of piece things together, but then also use science and medicine and get people feeling better. And did some basic research in college that was related to HIV, but it wasn't at the bedside, and I realized that really wasn't for me, and I needed to do something that was going to be clinical. And so in medical school got more into kind of clinical research and thinking that was going to be my path. I thought ID was great because it cut across every organ system. You didn't have to just focus on one organ for the rest of your life. You were going to be able to think about every organ system and see patients throughout the hospital on every different service, and just continually learning and thinking about different aspects of care.
So what is your job like now? What are you doing?
So as a fellow, I'm doing about half clinical work and half research. So seeing consults on the wards on both the general ID service and a transplant service, and really getting a broad array of cases. And then in clinic, getting to see general ID patients and HIV patients, and I really enjoy that aspect. You have patients that you see in the hospital, you see them in clinic, and they get better, and you might not see them again, but you help to make them feel better. And then you have your HIV patients who you get to have a relationship with and see over time and really form a bond. So it really just provides a great variety in terms of, there are some acute patients, some chronic patients, and every organ system. I love seeing my patients in clinic, but I also like thinking about the big picture and thinking about how health policy affects our patients, thinking about are things having their intended consequences, making sure that patients are getting good care.
So, how, in your perspective, how do you feel like the practice of ID has changed from when you were training to now when your daughter is training? Are there things that seem different to you?
Well, I think the training is still the same. I think trying to understand what a career in ID is has dramatically changed. When I first became interested in doing infectious disease, HIV was just beginning. And that has sucked up a lot of clinical care, clinical practitioners. And I think that besides just simply doing the clinical consult, there are so many other things that infectious disease doctors can participate in and do. There's administrative services, antibiotic stewardship, as I mentioned, wound care. A lot of times in the hospital we serve as a second medical opinion because we're seeing all those patients.
Well, and growing up, what was it like seeing your father working as an infectious disease physician?
He definitely worked hard, but he was able to coach soccer teams and be there for basketball games, and I think that was impressive to me as well, because clinical practice, if you need to see consults, you could see them a little bit later, so you can take that break to go watch your kids play sports. And I think that flexibility is something that hopefully I'll be able to work into my career as well. But I definitely think that we'd be out somewhere and run into someone, and they would just come over and talk to my dad and just thank him for everything he had done for them, and that left a mark on me as well. I remember we'd run into people and I would be impressed with how grateful they were, and I wouldn't know any of the details of the case because of HIPAA and all those sorts of things, but people were grateful, and they were coming up, and if they saw him out, it wasn't like they were going any other direction. They would make a point to come over and say hi and meet us, and I think that was something great to see as well.